A big hello to all RFA lovers here today. Our family meeting you after your exams, and on all the requests we have been receiving, we are here to take step forward, a flying start towards Mrcog Part 3. Thank you very much. Hi, Maria. Hello, Kaushri. Hi, Swati. Hello, Kruti. Hi, Nisha, sweetheart. Hi, Shobika. Hello. I hope you all are doing great. Hema, thank you very much for joining in. Hello, Sherry. I hope you are doing great. Amrita, thank you very much. So my family is here today after taking the exam. I have been missing you guys. For me, back-to-back sessions were going the same way, but definitely, yes, you people are special because you people are close to heart. It has been a long journey, and I can understand after the exam how a person feels, and you try to continue the same zeal and zest, and you try to continue the same pattern of study which you were doing, and suddenly it feels something is different in a day when you're not picking up the books. Am I right? Love you more. Thank you very much, Shazia Noreen. Thank you very much, Nagratana, my dear. Thank you, Asma. Hi, Noopur. Thank you for joining in. Thank you. You people happy missing my voice. I happy missing you guys a lot as well. Thank you very much. It's a mutual feeling. All right, so why are we meeting here today? We are meeting here today for all those students who have taken Mrcog Part 2 now, and they're waiting for the results, how to utilize. I can totally understand the post-exam feel. When I say we all had been passing through this, and I can totally understand that how nervousness on remembering the questions with different keys is. I can totally understand that we have anxiety to remember, oh my God, what did we do in exam? We all are discussing and feeling, I think this was the answer. No, it was also age 55. So that changes the answer. Lots of things coming up in lots of groups discussion, and that definitely gives us nervousness and gives us anxiety, and that's pretty much understandable. Now, you people are thinking about that, how did the exam go? Believe me, it's quite natural to feel that the mistakes are always prominent, in the discussions. And it's so natural that we remember those questions for which we thought too much, and now we are getting all the possible keys in the world for them. And everybody has got his or her own answers. So when you're discussing the questions, believe me, now you're coming up with different extended match questions, different keys that puts you under stress. However, I would like to tell you that even the person who tops the exam, after the exam has the same feeling, because there is no one who has taken 100%. I totally understand, Kaushri, Rita, Monali, I totally understand. Walaikum assalam, Uzma. Thank you very much. So at the moment, when you are thinking about this, no matter it's passing, no matter it's failing, my suggestion for all of you as a set pattern for life is to move forward. Let me tell you that we have to be realistic. We need to move forward. Life is a name of a continuous struggle. It is indeed truth. And let us be closer to facts, which is that we would pass the exam, we'll move forward. Unfortunately, if it would be a failing result, even then we will move forward, because this is what we have to do until and unless we reach to our goal. Definitely, yes, Hema, absolutely. This is what I want to say. Now, one day we are going to feel, for a second day, we are going to feel, for third day, we'll cry. Fourth day, we will wipe our tears and we'll stand up again. This is what, the Almighty has given us a power inside. Had it been not the fact, all the big names, the popular names in the history, they would not have created a history. Do you people get that? So whatever is the situation, we don't have to think about passing or failing. Whatever we are going to encounter, we would step forward, because this is what is life. The biggest trouble, even if it gets, the biggest hardship, even if we get to see in life, it definitely brings up ease, because human being is made up of in such a manner that we have got some capacity of absorbing and capacity of fighting back. And this is the beauty. And this makes us different. right? So whatever is the situation, I'm here to tell you guys that we don't have to think about that we'll pass or fail. We'll think about moving forward. Hello, Indy. Thank you very much. So my question to all of you is that shall we take a start? Yes or no? Or shall we keep on waiting for 1 month and let's see that, okay, what happens? And then we're going to see and we'll waste these 30 days? Yes or no? Thank you, Rita. The answer is yes, we are going to take a start. Right. Thank you, Kruti. That's my girl. The answer is yes, we should utilize these days. For us, every hour is important. Every minute is important. That's my girls. Thank you very much. You all need to take a start. Reason being, whatever is going to be the situation, we would face it accordingly, and the hard work never goes wasted at all. It never goes wasted. Right, Anna? Yes, Garji? Yes, Kashri? Very well done. Thank you, Shazia. That's my hardworking girl. All right. Now the question comes that how to utilize this 1 month perfectly. So the first thing is that you people have to understand the gist of the MRCOG Part 3 exam. And that's what I'm here for. That's what I wanted to discuss with you guys so that you people are very comfortable in taking a start. See, so the question is that how to utilize this 1 month so that whatever we face in the end, we are going to move forward accordingly. I always tell you guys that for any exam in the world, when you are approaching that exam, the very first thing is to understand the concept, the pattern, the gist of that exam. Because when you understand the gist of that exam, that is your first step to move towards your goal. Because without understanding the scorecard, without understanding the curriculum, of course, your preparation would be haphazard and it would be scattered. So this is the biggest mistake which students, they generally do, right? We have got 5 books for guidance. We have got Lisa Joel by College, which is always the best one to start. So in this 1 month, I would suggest you all to start with Lisa Joel. You people ask Safa, I've got all the books in the paid Telegram channels because you are premium students. You people can definitely join in for this channel and download all the books, take the printouts and keep it with you, right? So this is step number 1, Lisa Joel. And we have got an Oxford specialty training tasks. We have got Tony, we have got Get Through, and we have got Justin C. Kunje for the discussion. We have got these 5 books, which generally give you an idea about MRCT Part 3 OSCE. So I would suggest all of you to take the printouts. If you're happy to go with the online, it's absolutely okay. Shobika is laughing like anything. Shobika, yeah, like Safa loves the extended match questions, right? You people had been cramming it up like anything. So this is the same. But let me tell you guys that like we were doing the copy-paste questions from this in exam, it doesn't happen from the books, but I will guide you specifically when you'll come up in the course that what exactly you need to do. So I just always give 200 stations to students and I tell you that yes, your exam is only from these 200 stations. I don't want you to do one more or one less, only these 200 stations and nothing is going to be out of that. All right. Yes, Shobika, this is what students had been saying. All right. So what is the starting point, Nisha? I'm loving this atmosphere of a family which we enjoyed in MRCT Part 2. Thank you very much, Nisha, for all these giggles, my dear. All right, so what is the starting point of MRCT Part 3? The starting point is understanding the exam. You know why, Divya? Because there's a transition from a written exam and a transformation to a speaking exam. So the very first thing is that we all have to understand, Amrita, that what is the difference between the preparation? See, you do 100 single best answers, you do 100 extended match questions. That is a different set of preparation because you're reading, your writing, your thinking process is like on your own. The problem here is that we have to deliver the information right there in front of the examiner, and that does require fluency, that does require your confidence, and that does require quick and fast thinking. I mean, the brain should think and the tongue should work in the same pattern fastly so that the speech and the brain thought process, they both are going side by side. Many of the students, they do feel difficulty in this transformation because they start fumbling under stress. They know the things, but they're not able to communicate it in a beautiful way. So that's what I'm here for. Difficult lines, all the easy lines, how to tell, how to explain the difficult topics in just like crisp 2-3 lines. We are going to talk about when we will be doing the topics, but we'll have to prioritize ourselves. If you go around so many testimonials around that, you people would be seeing that January 22 students who took exam after their results were declared in the end of the February, March they started, and April, 1 month they had complete. In March, they were just getting oriented with this part 3. April they had, and May was the exam. Same is going to be the case with you guys, that the result is going to be in August, and September, October only. September, you'll just get the orientation, and October only, in November is the exam. So if they had been doing it perfectly, because Shobika, the time of the applied clinical knowledge, that is perfect for you guys. So I always prefer taking the exam quickly. Like I took my part 3 in 1.5 months after my part 2. Yeah, and I managed to clear. The benefit of taking quickly is that the theory part is quite fresh. For example, my 2020, or for that matter, 2019 students who have not taken MRCG Part 3, they have to revise the entire curriculum of the Green Top Guidelines, the NICE, of course, the recent talks, everything again. You people just have to work on the communication part, because the theory part, you are better than all, right? Because you've just covered it up. So that's the basic benefit which the recent students they have. And I never suggest taking a break or taking a long-term preparation until and unless I be very open and honest to students, until and unless my certain students who have got a language barrier, who have got difficulty in communication, I do tell them that please take 6 months, because for you, speaking and understanding and then communicating is a trouble. If you are good in language, or for that matter, even if you're mediocre in your language, even then you can cope up with 1.5 or 2 months in preparation. That's pretty much doable in 2 months' time, provided that you've got a good grip over the language and you don't have that language barrier. Many students in different parts of the world, they do have different languages and they face difficulty in putting in their ideas when it comes to English language, right? Moreover, it's absolutely understandable that you people take time. 2 months, of course, I would expect more time from you guys. Now, the other type of students who are not taking November, even then they will be starting next month. So I always keep like 2 types of batches. I kept the same for your last January batch as well. 6 months course and 2.5 months course, right? So the 6 months course would also be started now, so that they gradually keep on going, like 1 session in like 3 weeks, and they start their preparation so that the library access starts, the sessions they start for them, but they are going to aim May 23. Now, how we are going to decide that we are going to take November 22 or May 23, right? So far, there's no February exam announced, but if at all they announce a February diet, definitely we are going to avail that opportunity, all right? Okay. Now, it depends upon your family circumstances, because I would need definitely 6 to 7 hours from your result day till November. If you're able to give that, that will be perfect. I mean, nothing like that. But if you think you've got some family commitments ahead, if you people think that you won't be able to do that because it's going to be a little more tough as per the circumstances around, so it's okay. We will plan the next exam, but the start would be the same. We won't delay the start, because I tell you again, part 3 is about communication Part 3 is about practice. Anam, any student who has taken Mrcog 3 OSCE, definitely yes, can take MRCPI and Mrcog OSCE in 15 days preparation, because that is the most difficult OSCE out of 3 exams. Right? Out of all 3 exams, it is the most difficult in terms of standard. Okay, so it is absolutely. Zainab, from the result day, I definitely need 6 hours, right? From the result day. And you will do it. You people would just have to cram up my 200 stations, that's it, right? Nothing else, all right? So whatever is the situation, we have to understand this point that we will do the November or May 23 as per our ease, but we'll not make a delay in the start. All right, absolutely okay, Shobika, that's absolutely understandable. I'm keeping, many students have joined already, but I've given them this opportunity that they can freeze. If at all the result is not in favor, they can freeze their seat or they can get shifted to the next year. It's absolutely okay if you want the website starting now. And if you want, like, I think 6 or 7 students have already joined in 60th and 61st. Okay, so it's totally your choice. If you want to join on the result day, even then it's okay. The new batch would be starting on that day. Many of your friends are in the current batch, and I've given them this option that if at all the result unfortunately would not be in our favor, it's absolutely okay. The course would be frozen and they can just utilize it later. That's not a problem. Okay. Yes, Nazia, absolutely okay. Whatever you people feel comfortable, that batch would be yours. You all friends would be together. All right. Now, I have to make you understand the outline of the exam pattern, because this is our students together at this point. Therefore, you people need to understand the exam pattern. All right. Okay. The first thing you people need to understand is that it is a circuit, right? It is a circuit. It's a one-day exam, okay? And we've got 14 different types of station. For each station, friends, we have got 2 minutes to read and then 10 minutes to present that station. So that makes 12 minutes. So we have 14 times 12 plus 12 plus 12 plus 12. 2 minutes we will read, 10 minutes we will present. 2 minutes we will read, 10 minutes we will present. Again, 2 minutes we will read and 10 minutes we will present. So that makes around 168 minutes in a go. In Mrcog OSCE, we have got preparatory stations. Like in one station, you're reading only, you've got 10 minutes to prepare, especially they give the clinical governance station, making the incident reports and all. Here in Mrcog 3, there's no break and there's no rest station and there's no preparatory station. What I mean to say is that it's back to back. Here we have a slight deviation. Since the COVID times, like when we were taking our exams, of course, there was no COVID. So we were directly going to the college, and in the college, we were taking the stations, right? So 14 stations face to face. When you are taking on-site exam, 14 stations are back to back. Like you read 2 minutes, you go inside the cubicle, you present 10 minutes station, you come out of the cubicle, next cubicle outside, you read for 2 minutes, and then you present for 10 minutes. And in this way, you complete your 14 stations. However, when the Oslo was started back in 2021, so the Oslo exams, there were like 5 exams in 2021 onwards, right? In Oslo, thank you so much, Sukriti, thank you. All right, so in Oslo, we had a break, and every time after 7 stations, they give a break. In one exam in January, they gave like 6 minutes break, then they exceeded it to 10 minutes. In the recent exam, it was 12 minutes. So it varies. They announce it earlier to exam, but in Oslo, when you're online taking the exam, they give you after 7 stations, they give you a break. So 7 stations, you have a slight break of like 7 to 10 minutes, and then you've got these next 7 stations. Clear? Oslo is an online system, Koshi, where you take your exam sitting at home, right? Garji, Oslo is an online system by college where you're taking exam at your home through that format, through that application. That application is known as Oslo, right? Right? Okay. Now I need to tell you one thing. 2019 November was like my last batch, which gave face-to-face before COVID. 2019 November, right? That was my last batch, 2020. Unfortunately, the entire 2020, there was no exam, right? And people kept on, like, the courses were going on, but my students were not getting the seat because there was no exam at all. In 2021, from January, they conducted 5 OSLers because there was a huge backlog. Of course, the UK students and ST5, they were waiting for like getting their part 3, and they were also in need of doctors. So they made this format in which they did this OSLer system, right? Now, this 2020 and 21 onwards, OSLer had been going on. Last time, they made first time face-to-face open because the COVID situation was better, right? Sukriti, UK students this time had first time ever face-to-face exam in the May, right? However, it was only face-to-face in May 2022. It was only face-to-face for UK students in college. And there were 2 days face-to-face conducted. However, India was online, OSLer, global, Malaysia, Singapore, Hong Kong, Gulf countries, everybody was online on OSLer. However, UK, first time after the COVID, for 2 days, day 1 and day 2. And my many NHS students, they appeared in face-to-face and they enjoyed it because the things were pretty much back to normal. Now, what did they announce for November? They've announced both the seats for November. Face-to-face, they've announced in United Kingdom, they've announced in Egypt, and they've announced in India as well, right? However, they have announced that we are going to have OSLer seats globally as well. So you've got both the choices to book. If you can travel, I'm going to give you the differences between both, and we are going to discuss which is better. Shobika, I knew that this question would be coming up. I've made a table like Mrcog2 giving you the gift slides. So I've made a gift slide on that, right? So I'll just give you in a bit, okay? Yeah, I knew it. I know you guys, and what are you going to come up with? So I'm going to tell you the differences of each, all right? Okay. So before that, I have to tell you that so far, Maria, Lebanon, that is Portugal. It is going to be it is going to be the Mrcog exam this time. It is online, Maria, from there. All right. Okay. All right. Listen to me, friends. All right. So what are the types of the stations we have? I told you guys that we've got 14 stations. You people understood that, right? 14 stations. When I say 14 stations, it is 14 different modules, okay? For example, 1 station from early pregnancy, 1 station from antenatal care, 1 station from maternal medicine, 1 station from gynecology, 1 station from oncology, 1 station from surgical module, 1 station from postpartum, you know, like this. They have 14 different stations from 14 modules. So we have module-wise study. For example, you cover up early pregnancy, you say, oh, yes. And I've got complete syllabus, my own syllabus, like all early pregnancy topics, they are together. And we have compiled it in a way that nothing in the world would be left if you just do that syllabus, right? All the important stations of the world are there. You don't have to go anything right or left. You just have to cram it up. That's it. Okay. So in this way, all module-wise topics have been designed for students, and you just need to put the page number. For example, my students, they know if it's a pregnancy of unknown location, they will write down, okay, so it's like Ma'am Sidra, station number 2 in session. And if they'll write for something which is not an exam station, molar pregnancy, station number 4, Oxford, page number this. So I always guide them to be organized from the very start. This is my responsibility. Once we'll take a start, you people all would be in the right direction. Okay. Now, you people need to understand that out of those 14 station, right, we have got different types. One is a structured discussion. The other is a simulated patient task. And the third one is a simulated patient task, but with a lay examiner. What does that mean? Structured discussion is you, for example, Sukriti is there and she goes inside the cubicle and she has got an examiner. And it's only examiner and Sukriti. So I mean, 2 people inside. So it's like a viva which you people had been giving throughout your medical school days. Yeah. So in that type, you just have to talk to the examiner and answer the question. Right? Sukriti, no, you won't be crying at all. All right. So the structured discussion means that structured discussion is not a patient. You've got an examiner, right, Kaushri? And examiner is going to ask a question, for example, asks you about the clinical governance aspects. For example, it's a herpes structure discussion, asks you about how do you manage the primary herpes or the recurrent herpes. So you have to answer from the guidelines. I mean, the discussion with your examiner, simple. These are 4 stations out of 14. So 4 structured discussion in exam. It's not that 4 structured discussions would be like in a go, 1, 2, 3, 4. Randomly out of 14, you will have a structured discussion, a simulated patient task, or a simulated patient task with a lay examiner. Hello, Carolyn. Glad to see you, sweetheart. Thank you very much for joining in. A happy family here. Thank you, Divya. All right. So the next 6 stations, which I want to tell you, is a simulated patient task. That is, we don't have an actual patient, but a role player is sitting with instructions and would mimic any sort of a disease. For example, a Graves' disease the patient has, or a patient has got sickle cell disease and she's here in the clinic. You are in the antenatal clinic. You have been given your instructions that you're one of the doctors in the antenatal clinic today, and you've got Mrs. Jazz Merritt, and she is with sickle cell disease in 10 weeks of pregnancy, and she's here to discuss about her pregnancy plan. So Mrs. Jazz, who is a role player, would be having her instructions, and she is a simulated patient. Do you people get that? Hi, Yenny. Thank you very much. No, absolutely. You're welcome, sweetheart. Carolyn, if you would have been from the start, we decided that we are not going to think about the exam. We're just going to think about future. All right. Okay. Did you people understand that what simulated patient task is? Now, in structured discussion, it's you and examiner and no third person is in the cubicle, right? When it's a simulated patient task, it's going to be you and your patient, that is a simulated patient, a role player, and an examiner is sitting, but you don't have to talk to examiner. You don't have to look at the examiner. The examiner is just an observer and is marking you, listening to the talk between you and your patient. That's it. Examiner does not interfere, is just observing and giving you the scorecard. That's it. Do people get that? The second type of a station, these are 6 stations out of 14 simulated patient tasks. Got it? Perfect. Okay. Now let's come to the third type of a station. The third type of a station is the game changer in exam, because these are 4 stations where simulated patient would be there. You would be there as a candidate. However, instead of 1 examiner, we will have 2 examiners here. So 2 examiners would be here discussing. Okay. Shobika, my dear, do me a favor. Yeah, I'll tell you. Shobika, put the link from A and B into the open Telegram, my dear. I think Safa is not here. Yeah. All right. Thank you very much. Okay. The open one, part 2. Shobika, okay? All right. Okay. So we were talking about that we are going to have the simulated patient task with lay examiner. All right. Now, what I wanted to discuss with you guys for this is simulated patient task will have 2 examiners. Why? Because they are assessing you on certain skills, specifically the type of the stations where we have communication difficulties. So these are the type of the stations where the lay examiner is there. For example, the breaking bad news, it's an anencephaly on ultrasound. Breaking bad news, it's an IUFD. For example, breaking bad news, it's an endometrial cancer. These type of stations, a second examiner is there who is a lay examiner, who is not an obstetrician or gynecologist, but is actually the examiner who is assessing you on your communication. Specifically, she doesn't know about the applied clinical knowledge, but definitely you're going to be scored by 2 examiners. So these are high scoring stations. They are 4 in number, but generally high scoring stations. Do people get that? Do people get that? Shobika, Asma Mir, do people understand this? Kaushri? Yes? Carolyn? Yes, Anam? That's perfect. Okay. So in simple words, in structured discussion, there are 2 people in the cubicle. In simulated patient task, we've got 3 people in the cubicle. And in simulated patient task with lay examiner, we've got 4 people inside. So Amrita, we need to understand the type of the station. So 4 plus 6 plus 4, that makes total 14 stations. Am I clear? Asma, generally, I always tell students that you have got a margin of like failing 1 or making borderline 2, 3. So around 12 stations, if you're doing superb, you are very safe in exam. However, it is domain-wise score, so I'll tell you in a bit that how the scoring is done. Okay, so this is basically how we took exam in college. After it's been 2 years that the college had not been conducting like this, but just recently the UK students, they had it this way. For example, Asma Mir is going to start from station number 5 here. Right, so these are the candidate instructions which are actually pasted on the outside outside wall of that cubicle, right? So here you have your 2 minutes, you read it, and for example, Asma is standing here, right? She's going to read all these instructions. When 2 minutes, the bell would ring, right? Here the bell would ring, and she'll go inside and she will present for 10 minutes, whatever the station is. So let me tell you guys, the very first line of the candidate instruction at the top is super important because it says you are having a simulated patient task in this station. You are having a structured discussion in this station. You are having a simulated patient task with the lay examiner in the station. So in the first line, they describe the type of the station. And this is the first thing you people have to notice because you should be knowing that how you're going to enter into the cubicle. Do people understand? All of you, did you people understand that? Right? This is what you people are going to do that. Okay. Questions in those. Only in the structured discussion, the examiner is going to talk. Otherwise, it's only your and role players talk in the simulated patient task. I mean, the 6 alone ones and the 4 with the role player as well. Only in 4 structured discussion, examiner puts forward the questions and you people have a mutual, like, you know, exchange of answers and question in those 10 minutes because it's a structured discussion. Got it, my dear? Okay. Now, if Asma Mir has started from station number 5, she will go to station number 6, then station number 7, and then station number 8. I mean, 2 and 10 minutes would go on. And she will end her circuit at station number 4 because she started from station number 5. Similarly, the person who started from station number 6 would end up at station number 5. The person who started from station number 7 would end up at station number 6. So this is how 14 students, they revolve in a circuit. Could I make myself clear? Did you people understand that how the exam scenario is? So this is how they keep on revolving. 2 minutes, 10 minutes, 2 minutes, 10 minutes. And from wheresoever you start. In the waiting room, they give you your number. For example, I got my number that I'm starting from station number 2. So I immediately, when they made us in a queue, I had to reach to the cubicle 2. So I ended up at station number 1. Do people get that? So in this way, you're going to take around and you're going to just, role player is not marking us. However, Amrita, settling a role player, definitely the examiner is always giving you a positive score for that when your role player is very comfortable. For example, my exam, 1 or 2 role players, they definitely said in the end, so doctor, I would definitely be pleased to meet you again. I said, oh yes, I passed the station, right? Similarly, in a breaking bad news, if your role player is very comfortable talking to you, you get an idea, yes, you're passing. Moreover, in the negotiating stations, home birth is a very common station in labor module. So the patient previous to cesarean wants a home birth, you know, and you have to counsel her regarding the pros and cons. If your negotiating skills are superb, perfectly around mid of the station, you come to a conclusion, yes, you're passing because your role player starts, you know, agreeing to what you're saying. So these type of skills are very important. Role player is a simulated patient who has been given instructions, Shobika, that she is gravida this, para this, age is this, name is this, and she is having this disease, and she has been given a sheet that these are your instructions and you have to role play this disease. Got it? Right? Okay, thank you very much. There had not been any sort of this, but yes, for suture, for episiotomy, at times the mannequins are there, right? But generally there's no such station. Monali has a question here, so we can't have a role play card. No, Monali, we don't know what the role player says. We just have to chat with role player. We can't see what the role player has. Okay, actors are role players. Yeah, okay. Now you people have to tell me, just to check your understanding, what is this first type of station, please? How many people are there? What is this first type of station? See this girl full of anxiety and stress? What is this type of station, please? The first one? Thank you very much, Nupur, my girl. It's a simulated patient task with a lay examiner. What is this type of a station? Where the candidate is sitting with the examiner? Thank you. The second one, Maria, thank you very much. It's a structured discussion. And what's this last one? Where we've got a role player, an examiner, and a candidate? It's only a simulated patient task. So we have got these 3 types in 14 stations. So today, if you understand the outline of the exam, that's going to be perfect. Let me emphasize on this again, that 4 stations, which are the clinical examiner and the lay examiner, these carry highest marks, and you tend to pass the exam with flying colors. If at all, you do great in the lay examiner stations, and they are generally difficult stations. For example, sexual assault is a lay examiner station. In exam, breaking bad news, cancer stations, intrauterine fetal death, angry patient, angry husband, all these are lay examiner stations because they put you in difficulty and your communication skills are being tested, which you don't have to worry about because you just have to cram up Sidra slides. That's it. Okay. All right. Now, we have learned the pattern. The second thing is that how we have the scoring of the exam. This is very important to understand, because if we don't understand that how we are scored for this exam, definitely we don't know that what is that thing which we need to target, right? You are scored as per domains. And when your candidate instruction sheet is outside the cubicle, the first line says that what type of station it is. It's a structured discussion, a simulated patient task, or a simulated patient task with a lay examiner, all right? After that, they say you are being tested for these domains, and 4 domains are written on the top. Then your candidate instruction starts with the role player name, or for that matter, the scenario. And in the end, they write, these are the tasks which you have to perform. So this part where they give you the domains are very important, because the examiner has got the scorecard as domains. We've got information gathering as a domain. We've got communication with patient and relatives as a domain. We've got communication with the colleagues as domain. We've got applied clinical knowledge as domain, and we've got patient safety as domain. Am I clear? Did you people understand, right? These are the domains which you people have to understand. Okay, now, what do we have in this domain? We need to understand for this that information gathering and patient safety, communication with a colleague, applied clinical knowledge, the score is like 2, 1, and 0. Unfortunately, 0 means that you did not touch any of the point in that domain and you're failing. 1 means that you have touched partially the points in that domain. This is how the scorecard looks like, okay? And you are borderline in that domain. 2 means that you were perfect and you touched all the points and it's a passing domain. So the result is domain-wise, okay? In information gathering, for example, it's a heavy menstrual bleeding station. You've mentioned that there are certain points in which there is an static. So that means that that is must to mention, right? So whatever you go with, for example, you've mentioned that it's going to be a score like that you have mentioned everything. If you just miss out anything, it's going to be like borderline. And if you don't mention anything, they put a cross on that and it's going to be 0. So you need to understand the domains. So again, 2 is going to be passing, 1 is going to be borderline, and 0 is going to be failing. Whatever domains they have given in the scorecard, you are being tested for the same. So how the marks distribution is. In structured discussion, generally 3 domains are there. So maximum score would be 2 + 2 + 2 for each domain, 6 for 1 station, 4 stations total. So a score of 24 for all structured discussions in our 14 stations in exam. Got it? Simulated patient task 6 stations. They've got 4 domains to be tested. So 2 plus 2 plus 2 plus 2, 8 for 1 SPT, and 8 multiplied by 6, 48 score is going to be for simulated patient task. Layman examiner stations are 4 in number. However, we've got 2 examiner. One is same as that of SPT, 2 plus 2 plus 2 plus 2. Layman examiner has got 3 domains. Layman examiner do not have the applied clinical knowledge because they're not from obs and gynae. They don't have the applied clinical knowledge. So 4 stations, one examiner is going to score 8 and the other is going to have 6. So 32 plus 24, 56 score for only these 4 stations. So total score is 1 to 8, and out of that, 24 for structured discussion, 48 for 6 stations of simulated patient task, and 56 by 2 examiners for the lay examiner stations SPT. Am I clear that how the total score actually combines up and where you have to emphasize on this for each domain? Passing each domain is so important. Absolutely, Indy. In face-to-face exam, they give you a small writing pad, which is a notepad, generally from your hand size, and you can just turn over the pages, and they give you a pen as well. They give you on your first station, and then you have to return it on your last station. Clear? In Osler, there's a virtual pad. The virtual pad is on the screen. You can type the important points in the virtual pad, and this virtual pad is not visible to the examiner, neither to your role player. It's only visible to you in Osler, right? So it depends upon what type of exam you're taking. Either you should be good in typing, or you should be able to just scribble and write the important points when you're taking 2 minutes, and how you're going to prepare for that 2 minutes, I will let you know. Now, thank you very much, Sukriti. That's very important for you guys, because today, if you understand the concept, then my job is done. All right. Now, what these domains they contain? One by one, I will tell you. The information gathering domain tests your history skills, information regarding the examination of the patient, and the investigations as well. So basically, this domain is your history taking, examination, and what investigations you have to just do that or to carry out in that station. So you always start the information gathering. I'll give you my, Aisha Sadiqa, I will give you my template for that. So it's a presenting complaint, history of presenting illness, obstetric history, the gynecological history. So do you have any concerns regarding any medical history, or you go to GP for any medical concerns, any family history of concern? I will give you my fixed template, which is given on the website as well. You just have to cram it up and follow the sequence. Yes, we are going to alter that according to situation to situation. You ask if any operation had been on your tummy or down below, and you're taking any medications. Are you allergic to any medications? Do you smoke, drink alcohol? Pardon me asking, do you misuse any drugs? How had you been feeling generally in the last few weeks? What do you do to live, and how's the support at home? And you thank the patient for the information, right? So information gathering is about history template, which I allow students for the first 3 minutes, they can take the history, not more than 3 minutes. I'm very strict in this time management, because the more time you're going to take from the history taking, of course, your other domains would suffer. For example, yesterday, I was taking 60th batch, right? And while taking that batch, I realized in that time that if you're taking 7 minutes for history taking because you're not fluent, or if the practice is not going well, that means that you're taking time from your applied clinical knowledge. So all domains are important, right? It's not that we pass an information gathering and, we compromise our other domain because of strict 10 minutes we have. So we have to equally divide the domains. Communication with the patient domain is very important, because it's starting up. Thank you, Mona. It's starting up from the beginning of your introduction. Hello, I'm Mona. I'm one of the doctors in the antenatal care clinic today. May I confirm your name and age? Is it okay? I call you Jazz. So I've gathered from your case notes that you're here today because you've got a condition, sickle cell disease, and you're into your first pregnancy. Is that right? So communication starts from your hi, from your hello. So you have to practice different types of conditions, how to speak, how to communicate, how to keep the patient engaged, how to negotiate, and how to make a shared decision For that, we have got patient information leaflets in the telegrams. All the patient information leaflet folders are there. You just need to take print out and be updated in RCOG sites and NHS. Many of the topics, around 70% of the topics, are covered by RCOG patient information leaflets. But if some topic is not covered by RCOG patient information leaflets, we have to cover it up from the NHS patient information leaflet, right? Beautiful words, beautiful lines are given, how to talk to the patient, how to basically explain different types of scenario, and that's quite easy. Where we have difficulty in this domain, we are not able to introduce ourselves because of lack of confidence. We don't understand that where we are. For example, yesterday in the molar pregnancy, I came to accident and emergency as a role play, right? And a student of mine said that, yes, I'm one of the doctors in the clinic today. I stopped at that very moment. And I said, no, you have to redo. Why? Because the first thing you need to understand is, what is the situational awareness? Where are we meeting? I am bleeding, passing vesicles. I have come to accident and emergency. If you are thinking you are in a clinic, that means that you're not understanding that you have to be quick with this patient. She is in accident and emergency. So communication starts with understanding of the station. So you should be able to negotiate well. If you don't listen to the role player, your communication goes failing, and you don't have to speak big words. Again, I will give an example of a recent session of mine. Day before yesterday, a student said that, yes, I can understand that you've got this problem, and with this you can go into preterm labor, and there can be macrosomia, and there can be a situation where polyhydramnios. And I was like, I didn't understand any of this word, doctor. What are you talking about? Sorry, I'm not getting that. Okay, so you have to be clear that the baby can be bigger in size than the duration of the pregnancy. You can go into labor earlier than the due date or the expected date. The fluid around the baby can be more as per the duration of the pregnancy. See? So these type of layman terminologies you have to speak when you're talking to the role player, because the more medical jargons are used, the chances of communication with the patient failing is more. I mean, you have to be clear that using medical jargons reduces your chances to pass. So how do we do that? Right, Aisha? We do that with our communication skills, like talking and practicing chunks, breaking up information, practicing and making layman terminology dictionary, which I always tell the students at first day, that make your notebook, organize yourself, and try to put, for example, in the patient information leaflets, you'll understand if it's given peritoneum, it's lining of the tummy, right? They give you like neonatologist, the baby doctor. So these type of terminologies you start putting up and make your own dictionary so that there is no confusion in the end, and you are well versed that how we have to talk to the patient. We don't have to use big medical terms because that makes our domain failing, right? All right. Okay. So thank you, Indy. Communication with colleagues is that you have to name whosoever is involved in the patient care. It's MTT, consultant obstetrician, right? Specialized midwife, the baby doctor, anesthesia doctor, the blood doctor, the concerned medical specialist. So naming the colleagues is actually communication with the colleague. While taking this exam, please don't forget, you all are senior gynecologists and obstetricians at your workplaces. Handling everything alone, may that be gestational diabetes, may that be sickle cell disease, may that be venous thromboembolism, you are one person who is doing everything in your part of the world. Please don't do that in exam. In exam, you are an ST5, so always take care that if something is to be discussed as an MTT with a concerned specialist, always do that. For example, the patient, because of her renal problem, she has been on enalapril, now she's pregnant. So refer her back to the kidney doctor, the renal physician. I mean, don't stop the medication. For example, it's epileptic medications, any medical disorder. So you have to be an ST5. So don't forget that you are an ST5 in exam. So if you understand your position, definitely you will play the same role and you can discuss with your consultant wherever it's required. So this is the gist of communication with your colleagues. You keep practicing, you ensure that you're working as an ST5, you ensure understanding the responsibilities of certain colleagues around, you know that what your midwife can do, you know that what your nurse has to do, you know what your consultant responsibility is. You are easygoing in your station when you know the responsibilities, especially a very famous station is labor ward prioritization, which comes on each day of exam. Labor ward prioritization is actually a structured discussion which tests you in the communication with the colleague too much. So definitely I'm going to quote you on that, right? Patient safety, unfortunately, is the domain which is maximum failing for students because they forget the patient safety while doing. Confirming name and age of the patient is a safety. Patient says that I'm penicillin allergic in the history and you don't document that. You just ask it and you don't document that. It's failing patient safety. Examining in the presence of a chaperone, calling for help when it's required. In decision-making, be shared in decision, keeping the confidentiality, assessing the mental capacity, obtaining the informed consent, respecting the autonomy for Jehovah's Witness, safeguarding, risk management, prescription of the right medications, prescription of the right contraception, doing the responsibility and making a good triage of the labor ward. All these are patient safety points. The problem which I see in students is that they go from the top until the end of the station, the 10 minutes are over, and they forget that, yes, somewhere we were lacking in the patient safety. So you all should be doing perfectly in patient safety. And when you go to the website, a complete module-wise patient safety points I have made. Reason for that is that that's essential to understand. And I always tell students that keep your one pen, one highlighter. For example, if you see my notebook, all the purple marked are my patient safety points, you know. And if you see any station, I always tell them that when you're going through the template, from the start, hi, hello, till the end, you have to mark the patient safety points because when you'll be speaking to the role player or the examiner, that highlighted points would be coming up in your mind. All right, so I am doing patient safety side by side because this is what maximum students, they forget. Am I clear? So for each station, once you prepare one station, please enumerate the patient safety points. Right? You people would start loving your preparation when you will be organized in this in terms of the safeguarding principles, in terms of the clinical awareness, incident reporting. All these are patient safety points. Are you all with me in this? Sukriti, Aisha, Mona, where's everyone? Please don't be silent. Be active in the chat box the way you used to be in MRCG part 2. All right. Thank you very much. All right. Okay. So when you people will be together, you people would love it hands in hands because you people had been preparing with each other. So you people will feel the change in this transformation from part 2 to part 3. Applied clinical knowledge is what you people are perfect in. I mean, nobody is better than you in applied clinical knowledge. You exactly know what GTG says, what NICE says, and TALK says. Believe me, my students who had been older in terms of giving a gap between MRCT part 2 and part 3, they definitely face difficulty. Even yesterday, I was talking about 2022 recommendations of the Circulage and for that matter, the corticosteroids, right? Because we were doing a beta method, the preterm labor station. So what I want to say is that this is your strength. This is absolutely your strength, the applied clinical knowledge. If somebody has taken a gap, so we will revise the part 2 notes for that. So in applied clinical knowledge, another difficulty with students they face is that they know everything and they start like doing it like in one breath. The applied clinical knowledge might be passing, but the communication with the patient is failing. You always have to give an organized way, checking, understanding, doing in chunks. Never speak in one breath. I will give you especially the algorithms. Have you people gone through testimonial of Sapnami? Did you people see that she made a video of her room and she has shown all what the part 3 notes she had been making? And did you see her walls? Yeah, that was such a good example. In fact, I was astonished like anything on her hard work. She had made everything, every line, every module a separate folder. And she specifically told, ma'am, I want to tell others that, see, it's doable. But the only thing is that being organized is very important. That's on the page. All right, I will tell Sukriti, if you get it, please do post in the WhatsApps and the you can page link up the Facebook link in here in the WhatsApps and in our intensive discussion Telegram. right? Yeah, you can do that so everybody sees that. It's a very good, motivation for all of you that people have been working so hard to get this aim. So thank you, Divya, that's lovely. So for the applied clinical knowledge, I am comfortable that nobody is better than my students. Absolutely not. So what do you have to do outside the cubicle? See, you've got 2 minutes outside the cubicle. Out of that 1 minute, you have to do the reading. 1 minute, you have to make an outline that what do I have to speak inside, organizing yourself, right? Making an introduction, making an agenda, what information gathering points are important, and how I'm going to make a management plan. So outside the cubicle, I'm going to tell you exactly how you have to polish yourself, because this time is very important. I never suggest that you people be shaky in this point. Reason for that is that if you're not comfortable in your outside the cubicle, you definitely are going to enter inside the cubicle with tachycardia, palpitation, which is never acceptable because you start fumbling when you are having palpitation, right? So having a composed time, 2 minutes time utilization is super important, and that affects your inside the cubicle as well. So you start with your intro, you set an agenda that what is the reason the patient is here for. You take a very structured, beautiful information gathering. You address patient's concern. You give her the management options. You keep on checking her understanding and summarize the discussion. You give her the written information, and then you have a perfect closing to the station. This is the outline which you have to remember. For different types of station, I'll give you the outline always. Now, coming to the question that whether we would take face-to-face or OSLA. All of you see that there are certain advantages of both the exams. In face-to-face, the expression of the examiner and role players are easily understandable. So that gives you a clue, specifically when the patient is angry, the patient is having a response to breaking bad news, like a grief reaction. So Mahmouda, it is understandable in that point, right? And in face-to-face, it's okay, my dear. So Kriti, that's absolutely okay. We can take the next attempt. That's not an issue, right? But taking a start is must. I can definitely suggest you in 1 month that, all right, you're going to take it perfectly, listening to you guys, because every student is different, right? In face-to-face, no technical glitch is there because you're physically there. In OSLA, the advantage is that you don't have 14 stations in a go. You do have a 7 stations break, and then you, students, they quickly take some snack, they attend toilet, and they quickly get back to their seats. So OSLA, after 7 stations, give you a little break. So in face-to-face, after 10, 11, 12, 13, 14, everything is like on the spinal reflex. You're exhausted like anything. So you need to practice more for your exhaustion, for your stamina building, because it's like back to back stress, Oslo, the benefit is that time management is appropriate. Why? Because in Oslo screen of your laptop, you've got a timer. So it shows you 2 minutes reading time, and it shows you 10 minutes, and it's going like negative. For example, like 9, 8, 7, 6, 5, 4, 3, 2, 1. And when it's 1 minute, it's like it's in the center of your screen, and it shows like complete last 1 minute is there. So you can make a very good ending. Often in face-to-face, because you don't have a timer, it's an abrupt ending. For example, you're speaking something, you're in the middle of something, and the bell rings, and you have to, of course, rise up from your seat, and you have to move to the next cubicle, right? In Oslo, the timer is available, which is like the biggest benefit, I think, which is advantage, which as compared to the face-to-face. In face-to-face, we don't have any voice problem. And, you have a certain feeling when the patient, like it's a clinic environment and you're just doing like 14 cases, because it's more like, that you are just taking care of your clinic and it's just going on like that. Okay. In Oslo, the benefit is that it is, you're right there at your home, no traveling expenses there, and you're in your comfort zone. You don't have that stress of that examination hall, So that is something which is an advantage of Oslo. Of course, many people, they have to travel, they have their visa difficulties, their expense, of course, of traveling, then staying, then hotels and everything. So that is like one advantage of the Oslo. So what are the disadvantages? As I said that, no, it's not a Pearson Center, my dear. Osler is at home. It is at home. They give you a link. That link is given around like a week, 10 days before. They test you. Your face recognition is there. It's on your laptop or your desktop, whatever you're using in your home. However, you click that link, and on that link, the examiner comes on the screen, the role player comes on the screen. I've got a complete video of Osler. I will show to you guys, all right? A complete video that how the Osler is basically working. Sukriti, what is your address with college? Is it UK or is it India? Sukriti, what is your address with the college? UK? It's absolutely okay. You can choose Osler if you don't get on site. However, face-to-face is not a difficulty. UK students are very less. Yeah. All right. Okay. Face-to-face, of course, the disadvantage is traveling cost, difficulty in just getting, and the time and the disturbance and the discomfort you face for the visa and stuff. Definitely, there is a disadvantage of some sort of a stress. I mean, at home, you're not stressful. But at times it does happen that, the examination center has got its some sort of, palpitations and tachycardia and anxiety and nervousness. And that's, I think, pretty much understandable. So exam center has got its own stress. And you do feel stressful as compared to like sitting at home. However, the biggest problem in Oslo, which May 2022 students faced as well, that it's not only that you have got a very good connectivity, no matter you get like 3 backup devices, actually the role player connectivity, the examiner connectivity, that's so important. And they're sitting in different parts of the world. You know what happened with many of the students this time? Like, for 4, 5, 6 minutes, role player was now visible. And of course, the time is going up. In this time, they have, a rerun of stations. One of my students had 7 stations rerun when the exam is over. So she got free around 8 hours after the exam. So that can definitely be a difficult situation that adds on to stress so much that you're sitting right there and you're waiting for rerun, because not only you having a good internet, I mean, the role player, the examiner, and technical glitch is something for which, like, anybody can have any time. Because of course, these are devices, right? We can't work no matter we have the backups, but still these problems actually lose your confidence. And I know that many of my students, they were like sitting for like many hours and they had a rerun of the stations, and then definitely they couldn't give their best. So it does happen. You do have a chaperone, Shazia. The chaperone is looking after, but at times the connectivity is a problem. So this is the biggest. Rerun means that you redo, Hasina. For example, if for one station, the 10 minutes are passing by because it's like a circuit going on and your examiner can't hear you, for that matter, you are not audible or the role player is not audible. So they mark that station that this is not done. Once 14 station would be done and all the exam would be over, you will be waiting for your reruns. And that's what I'm saying, that few of my students, they had like 7 stations rerun. So that's like half of the exam done again. That definitely gives the stress, that second time, and you're waiting, you're getting exhausted, you're just keep on sitting out there, you're not able to leave Oslo. You have to stay because they're not permitting you to leave because your exam is not over. All the students, they were in the WhatsApp and they just came back from exam, and there were few who still had an exam starting by evening because they had to go through the rerun. So that definitely adds on to stress. So advantages and disadvantages are definitely there. As face-to-face, I told you that 14 stations are back-to-back, and students, they get breathless, running from one cubicle to the other cubicle. Another big disadvantage of face-to-face, even this time, students, they faced it. How many of you have seen the recent college building? We actually took our exam in the older building, but now it's a new building, right? So if you've seen the recent building, it's like we had huge halls. In fact, our convocations and everything was in huge halls. This time, they had this, small rooms, and the students were saying that, ma'am, we were so close by in the cubicle that in 10 minutes, we could listen to each other's voice. So that was like distracting. We could not focus on our station. Like, you can listen to other people speaking. And this time it was very obvious that in face-to-face, they were saying that, ma'am, it was so hard. The UK students were saying it was so hard that I had to say, like, few of the students that please speak a little slower. I can't concentrate on mine in the middle of the station. So the cubicles were very close. So these type of face-to-face disadvantages are there. But on the other hand, few of my Osler students who were not well versed, who didn't practice well, they had small, as if you've got a MacBook or they're taking it on an iPad, so they couldn't read the stations. So you should have a very good screen size. I always suggest for my Osler students that please take like 16 inches, a bigger one. Reason being that small station candidate instructions, they give you a lack of confidence and you're not able to pick up certain points. So these things are very important. I wanted to give you a glance of this, that these are the advantages and disadvantages. Moreover, in face-to-face, you people are all, studying on the books. So I always tell my face-to-face students that if you're taking this exam, the last 14 days, I ask them to like stick the stations on their walls. Because, reading on a wall with a concentration in 2 minutes and being a fast reader is very important. So I always suggest them that in face-to-face, you people, please, in the last 14 days, just take the printouts of the station and please stick on your walls 14 stations and do it in a go. You have to be very good in this because your attention and emphasis should be on picking up the candidate instruction perfectly, where you are, what do you have to do in the station, what are the domains. Moreover, in face-to-face, timing has to be perfect because you don't have timer. Right? So this is the disadvantage of face-to-face. The timings have to be perfect. However, on the wall of the cubicle, you should be able to pick up. Now, Osler advantage is that there's no disturbance, but disadvantage is that you're alone. You can't catch up somebody for help. It's only online. So that's also one of the disadvantages for we have to take care of. So whatever suits us, we are going to train us accordingly. We would do, Carolyn, whatever would be the best. Now, the biggest thing is that if you're aiming for exam, you don't have time on the booking day. Have you people gone through my video that how to book for Mrcog 3 on YouTube? You people have gone through that video. Then what are the steps of booking? Quick booking, because the booking is a big trouble. Okay, once we reach to that point, you all have to, I'll share the YouTube link. You have to see that. That's a very famous video because I've given the algorithm of steps that what preparations you need. A reason for that is that with blink of an eye, it's all sold. Mrcog Part 3 is like that. Last time it was better because the backlog is over because they conducted so much of Osler, but still you have to be quick in your preparation. So whatever we have to decide that it's face-to-face in Osler, it has to be earlier. I mean, when we are taking exam and the booking is started, prior to that, we should be clear what we are looking for. It's not that we open up the link and then we are thinking, oh my God, what do we have to do? We have to be clear that what we have to book, listening and thinking about all the pros and cons. Accordingly, we are going to book. All right. Yes, you know me, right? This is like how the things are easy, Aisha Sadika. All right. Sukriti does have, there's no technical glitch. It's advantageous in this way. Moreover, it's like more of a clinic thing. At times you don't understand the role play on the screen. Students, they do tell that. So my UK students were happy with face-to-face this time, Yeah. Yeah, that's one thing. Sukriti, see, once you decide for something, it's absolutely okay. If you decide for something, you start practicing in the same way. So if you decide for face-to-face, we would work for face-to-face, right? If you decide for Osler, we work for Osler because both the things, they've got different pattern. We need to be good in stamina building when it comes to face-to-face. We need to be good in our technical aspects when it comes to Osler. So we would coach and practice in a manner once we decide that what exam we are taking. All right. That's Monali, that's not a difference. Absolutely no difference because it's a competitive exam and your circuit students, they actually affect. So in 14 stations, they can't fail all the 14 candidates, right? No matter it's a very difficult circuit, even then 4, 5, 6 have to pass, right? So it basically is a competitive exam of your circuit. All right. Okay. Okay. So we all are going to take a start. This very moment, you people are going to take out the printouts. You will understand the syllabus. no matter this 1 month, eventually we face a little hard luck and the result is not in our favor. The hard work never goes wasted. This all would add on to your information. It would add on to your potential. It would add on to your knowledge, the basal knowledge. So nothing is going to be wasted. Have faith in yourself. The truth about the success is that it definitely has got lots of hardships. It is actually lots of sacrifices. What people see is apparently what actually is success. You know only that what you did for yourself. All right. So what I expect from my students is that you're going to take a start with the same zeal and zest. And on the result day, nobody's going to say, oh, ma'am, I wish I could have used the previous 30 days. So I would have covered so much. I'm taking a start now. What would happen till November? So I want that you people at least start with a patient information leaflet. You've got your wonderful study groups. Make that study group as a buddy. Whosoever wants to book is more than welcome. If you want to freeze it later in case there is some sort of an unfortunate or a hardship we face or some sort of a problem which we are not comfortable with, you can definitely freeze it. But if you want to join on the result, you're more than welcome. You people are my priority. As compared to the open students who are coming from outside, they're already booking, but definitely my own students are always the priority because I know exactly what I've taught you in part 2. I know exactly what you people had been through in this journey. So definitely yes, but what I expect is positivity with the same zeal and zest. Whole folder is Nazia in my part 3 channel. The complete channel is there, which contains all the books, which contain all the patient information leaflet, all the module wise topics, they are together, right? So in any of the situation, whatever we are going to face, it's absolutely okay. We will go back to Green Top guidelines. We will revise our notes of NICE. We will revise our talks, and we are going to be organized from today only. This is the only way, because taking a scattered, a shaky start keeps us shaky. What we need is, yes, my dear Asma, in the open as well, in the paid as well. For you guys, you're my part 2 students. I will tell Safa to give you the paid channel. That's not a problem. Okay, just after this, I'll put you. Where do I have to put, in A and B WhatsApp or in the intensive care? Where do you want me to put? Kruti, the steps of AOT intensive, okay, I'll put it there. The intensive discussion, all right, okay. The assessment of training, the steps she has put, Safa has put just in the WhatsApp today. Send it earlier, my dear, don't make it a delay. All right, because for November, if you have to appear, the last dates are of August. So we have to do it like now. AOT done, that's perfect. If anybody has not done AOT, please do it earlier. So that's absolutely okay, Manali. I was telling this today to Malik. Hello, Malik. How are you doing? You're silent, my dear. Malik, Australia. Where are you? Actually, anybody who has done the assessment of training anytime, it's okay. That is accepted. You don't have to redo your assessment of training again and again. Yes. Okay, thank you very much. Thank you. Yeah, thank you, my dearest. Thank you. All right. Okay. So this is, no, it doesn't expire. It doesn't have any expiry, please. Okay, once an assessment of training done, that's done forever. But the ones who have not done, please do it, right? Do it because you've got some last day till August. Or if you're aiming for the May 23, then it's absolutely okay. Then you can make a delay. But why to make a delay? If your training is done, then definitely start it like early. Okay, so today, what was the reason? Reason of meeting was that we are going to take a start. We would be organized and we will prepare our basics. The only thing is, it's not that on congratulations and celebrations, we take a start. Taking a start is must today only. So let's take a deep breath. Let's smile with the same positivity with which we read the MRCG part 2. We're going to start again with this, right? No matter it was in 2014, it's absolutely okay, Malik. Yes, it's okay. That is common for part 2 and part 3. Munali, that is the patient information leaflets, the Green Top guidelines, they're going to be the same. See, unfortunately, if it does happen that the exam is the result is not in our favor. If for any student this does happen, then we are not eligible for the September exam. Am I right, Monali? Yes. So it is going to be January 23. So we have got ample time for that. Okay, so let's think about positivity. People had been doing in 2 months. They have had spectacular results just in passing from the January batch and coming to the May exam. Same as for you guys, taking exam in July and then taking the part 3 in November. So you people can do that. However, definitely with taking this decision, I would like to listen to you guys. Many of the students I've talked in person, I mean, seeing your grip over the language. Few of my Arabic students, for that matter, few of my students who are from different areas like that of where English is a little barrier is there for the language, I would definitely suggest them to take next year, but taking a start is important. Do not delay the start. Even if you're taking exam next year, the start has to be now so that you just join the 6 months batch, right? And if you are having some sort of, support, then definitely take it as early as possible. And the day you will actually tell yourself that, yes, I'm ready for this, you will give your 100%. Because once you aim that this is the time, these are the days, you mark your calendar and I have to cover it up, you people would see the change because you'll be faster in your preparation then. All right. OET is for the GMC registration, my dear. All right, Nupur has a question. There are 2 types of seats, my dear. Generally, active participants, I can't take more than 18 in a batch because they have to present to me and they get their complete rotation. For example, we name them that, okay, this batch, Nupur is this day, Nupur is presenting. So the next day, Malik is presenting, okay? So Nupur knows that these are my presenting days. So for active participants, they have to present to me and get the feedback. Listener participant, they just observe the session, they get all the website, they get all the stations, but they don't present to me. I mean, I don't listen to them, right? They are listener participants. So if the finances is not one of the concern, then active is always better, of course. But if you just want to get the stations and you just want to observe, you think that you can practice on your own and it's okay, then listener is definitely a choice. Okay, Nupur, got it? Listeners, they just observe. They just listen to the session. They do get the live session link. They are in the study group. Everything is the same, but they don't present. They just listen to the session. Got it? Right. It's already given there. For you guys, you people will get the coupon, right? Right, Shobika? It's given. You just click on the link. I will tell Safa to give you the links and your off coupons as well. All right? Okay. Premium students, they definitely have their off coupons. Okay. All right. Okay. Any other question, please? Yeah, the links are there in the part 3 group as well. Devi, actually, the problem is that we've got 24/7 moderators are there, but they don't get the feedbacks because that's the difference. Yeah, that's the difference, Devi. Because feedback for what? When they're not presenting, they're just observing, then there's no feedback, right? Right? Okay. For actives, you have to present to me. You'll get your complete rotation that these are the stations you are presenting, and then you're getting the feedback and then you're correcting. Right? Shweta, yes, my dear, I am actually bound to open up a batch on the result, though 6 batches for November are already running, all the 55, 56, 57, 58, 59, 60, 61 as well. Now 61 is opened up and many of your friends are in 61 and 60. That has just been started 10 days back. And I think it would be going up to 62, 63, 64, 65, because last time on result, I had to open up like 4 or 5 batches. So again, Shweta, you people would be like my priority. I'll open up an active seat immediately because I'll be bound to. I know that on the result day, immediately people all over the world, they start contacting. So I'll open up 2 batches, right, accordingly. So whatever would be your aim the next year or this year. So we'll have different participations, right? November exam or the next exam, 2023. Accordingly, we'll give the schedule. All right. Okay. All right. Thank you very much. Part 3 students are too much. Yes, Aisha, because part 3 is about communication. So even people who don't take coaching for part 1 and part 2, they definitely have to take for part 3, because part 3 is something like, you know, no matter how good you are, in communication, but still you need to understand the gist of exam. And they are very fond of taking, multiple marks because they definitely need to understand the gist. And because it's the last part, they don't want to take risk as well. So that's the entire story of working hard. Hello. Hi, Navedita. How are you doing, my dear? You people have been busy, right? Hi, Vidhi. Hello. Thank you very much for joining. And it's okay. It's going to be shared in the in your group, right? Okay. So did you people understand the concept of the MRCG Part 3 exam today? I guess, Devi. Did you people understand that what MRCG Part 3 is all about, how the stations are, how we need to do the preparation? All the bases would be given there. So please don't worry about that. And Monali, they give you structured discussion from the recent talks. Yes, 1 or 2 stations from the recent talks, they do come. I always tell last part 3 structured discussions, last part 3 talks are important. Last part 3 years talks are very important. Okay. Yeah. Don't say that, Carolyn, my dear. I know busy in the hospital, right? Okay, so from today, what do we have to do? From today, you make a book, right? You make one notebook, big, thick notebook, and you make your layman dictionary. Start with the patient information leaflets. Get hold of all the 5 books. Either you take printout or you can just keep it on your laptop, right? Whatever you're comfortable with. And join all the channels and prepare your things. Read at least 1 to 2 patient information leaflets per day, right? And if anybody wants to attend the live sessions to just have a good understanding, daily 1 batch is going on, so you people can definitely join. That's not a problem. All right, all this information would not go wasted. Whatever it's going to be, that's perfect. Yes, Shobika, they are in the file section of the open group, right? And I'll share 1 telegram of mine as well. All right, okay, that's perfect. It was lovely seeing you guys. And if anybody has any question, please, more than welcome to ask. I've given you the permission to unmute, but you people are trained to stay mute as per the sessions of the regular and the fast track, yeah? So nobody did an unmute today because you people don't want to sing a song today, is it? Right? I didn't, okay, Asma is there. Yes, Asma, you want to say something? Yes, my dear. Thank you so much. Hello. Hi.
Hello. How are you?
I'm fine. Thank you so much. Yes.
Yeah. Alhamdulillah. Alhamdulillah. Yalla, we will see what will happen, inshallah, for the result.
I mean, everything is going to be fine as well. Let's hope for the best. Lots of prayers, sweetheart.
Yeah. Your voice was ringing on our ears.
Oh, I'm so grateful. Thank you so much. I hope and I pray that we have another Zoom meeting with congratulations and celebration. Thank you very much, Mona. Yes, my dear. So happy.
Just my question.
Yes, my dear.
Just my question that this assessment of training, I should sign the paper itself, or I should attach the recommendation letters, or exactly
it's given on the step. Both options are available. You can get signed and attach the documents, but they didn't then upload as well, right? But you've got a complete form you can fill in as well.
Okay.
Yeah.
Okay. Thank you.
Okay. Thank you very much. FNC8. Who is our student who is asking about the difference between the regular and the fast track? FNC8. Is it Mash? Hi, Mash. Is it you? No? Lakshmi Nagar. All right, Lakshmi, it's the same difference as that of regular and the fast track MRCG Part 2. My fast track Part 3 is very, very fast. And the students in the fast track actually have covered up the regular mostly. So they know the details, they know the modules, they know the domains, they are like prepared. And fast track, I do complete one paper in terms of like all modules together. So it's like a mixed presentations. In the regular, I do domain wise because I have to give the basis. I have to structure them that, okay, we'll do early pregnancy session, we'll do antenatal care session, we'll do maternal medicine session, right? So we go module wise. And Lakshmi, there we go like station wise, and it's like a mixed sort of a practice, which is very fast. Generally, all the fast track students, last time I had like 150 plus. So the fast track students are well prepared. They just need polishing, and the fast track is like in the last 8 weeks only. And it's very, very fast. Students, they know the things, but they just need the final polishing of speaking up. So we have like that batch is very, very fast. Okay. Right. Regular first, all the module wise, and then the fast track. So it would be quicker. Thank you very much, Lakshmi. Part 3 in the premium group could not see. Devi, it's already there, my dear. Where do you want me to put Devi? I'll put it now. Devi, where do you want me to put that? You want me to put where? Which Telegram? Premium or the fast track Telegram? July Premium you want me to put? Okay, I'm putting in both the links in the July Premium. I'll ask Safa to put both the links there with your coupon, all right? Okay. Yes, I am putting in now so that you don't miss it out. All right. Okay, thank you so much. Just in a bit, my dear, I'm putting in there. Okay, I'll put it fast track as well, both, right? Whatever you want to join, I'll just put in there. Okay, thank you so much. Any other questions, please? It was lovely meeting you guys. It was long-awaited meetup, which we were planning. Thank you so much, Anu, my girl. Miss you all so much. Yes, my dearest.
Hello, ma'am. How are you?
I'm fine. How are you doing?
Yeah, okay, ma'am. Fine. So, ma'am, I have a question regarding the listener and active participant. So,
Sure.
Regarding the active participant, is the student actually presenting to you just directly, or they are just recording their presentation?
No. It's in the live session only. We have a station on the screen. They present that station. For example, 2 minutes, they read the station in the session, right? 8 presenters in one session present. So you all know that who is session number 1, like 8 presenters, 8 stations we do in one session, right? So 8 presenters in the live session will be presenting. Okay. So 2 minutes they read, the 2 minutes they read, 10 minutes they present. And then after that, I give the feedback. And if I have to, redo the station, or if I tell certain aspects of the station, then we do it again. All right.
Okay.
So in the live session, they present. However, my dear, in the study group, active participants are setting in the records daily as well, because for each batch, I mean, Safa is there, Madhu is there, Ash is there, Gori is there, Sam is there, Kalai is there. So all these are giving the feedbacks on their records as well, because they prepare them for my session. I mean, after 1 week, if there's a session, for example, 60th batch, yesterday they had the antenatal care. Now they are preparing for the maternal medicine. So since morning, they are putting in the maternal medicine records, that it's our turn, ma'am. We need to be like quick in this. And the moderators are giving them the feedback. Please see this template on the website, and they're preparing them. So for each batch, different moderators are there so that they can like prepare them, and then they get ready for the live session, and then they present to me.
Okay. So, ma'am, what I can actually, so for the active participant, they are presenting the recording as well as presenting directly to you, right?
Yes. They are getting feedbacks by moderator in preparation days, right? In the WhatsApp study group, and they are presenting live to me in the live session.
Okay. So for the listener participant, they are not actually presenting at all, right?
They are listening, yes. They are listening, they're getting everything, but they are not speaking, yes.
Only listening.
Yes.
Okay. So another thing, ma'am, is there actually, there is also the fast track in the Mrcog part 3 batches also, right?
Yeah. Last 8 weeks, we have a fast track, which is very fast and which is like all mixed. I mean, complete exam paper 1 day.
In part 2, there is also in the part 3, there is also
yes,
yeah. Okay. So just now you have actually mentioned that we can join the live session also if we want. So is it after joining joining your part 3 courses, or we can join now also? Because we are planning, I'm planning actually, if after
November?
result, inshallah, if I pass, inshallah, I will join that
Inshallah, that's fine. That's absolutely, the moment you're going to join, that's okay. But right now, even if I, make you have, for example, if you want to attend a session, that's not a problem. But understanding would not be there, because it's like an organized way, getting the website, then opening up the templates, then preparing, then listening to my audios on the website, for each batch, it's there. So that definitely after registrations, everything is going to open up. But you guys are mine. There's not a problem. If you people want to attend any of the session daily, one part 3 sessions, there's not an issue at all, right? You're more than welcome. Not a problem. Okay.
Yeah. So where we can actually get the link if we want to join?
Whenever you want to have a session, let me know. But the understanding is going to be a little difficult for you guys. You'll be overwhelmed because they are preparing certain things out of what has been provided to them, right? They are preparing for this. But as an observer, that's not a problem, right?
Okay, ma'am. Thank you so much.
Thank you very much. Devi, the batches are starting as soon as they're getting completed. I told you that 55, 56, 57, 58, 59, 60, and now 61 is half. All 60 and 61 is like booked with NHS students. All the UK students are in 60 and 61. 61 is half done as well. So 60 already 2 sessions are done. Yesterday, I also had 60th batch. So they all are for November. So they all are aiming for November. So I expect that after results, because lots of people, they want to book and they're messaging me, they're just waiting for the results. So it's going to be a faster for you guys. It won't be like once a week. It would be, I think, a little faster because you have to cover up 14 modules. And the curriculum would be, of course, quick for November people. For May, it's not a problem. We'll start in time, but we'll take it 6.5 months or more preparation, right? So that you people have ample time for revision. So accordingly, you people can just aim on the result data if you want to join the May one or if you want to join the November one. So according to that, the schedule, the curriculum, everything would be same. The only thing is that the spacing of the sessions would be different. It would be faster for the November people, of course, because we have to cover up in a shorter time. And for the November, May people, it's going to be a little gap between the sessions is going to be longer. So they'll get like more time to prepare because they'll be aiming the next exam. Okay. Carolyn, this time they've not announced that. Last time we had a February 2022 diet. That was an extra one. But this time they've not announced this time so far. If they create an extra diet, that would definitely be beneficial. So that would be great. In fact, you people can make an email for the 2023 diets if there's an extra diet in the early part of the year. Okay. All right. I've already done that, Shazia, in the July group, my dear. Shazia, did you get that in the July Telegram? Got it? All right. Thank you very much. Any other question, please? Hello? Okay. Thank you, sweetheart. Yes, my dear, please.
Hello, Nupur here, ma'am.
Hi, good evening. Nupur. Yes, my dear. Good evening. Yes, sweetheart. How are you doing?
I'm good, ma'am. How are you?
Great. I'm very well, my dear. Thank you so much. Yes, sweetheart.
Ma'am, could you just post these links in the fast track group also, because I'm not in the premium group?
Yeah, I remember that you were not there. I'm just doing that, sweetie. No worries at all.
Okay, ma'am. And yes, ma'am, is actually I have a few exams coming up in India. Just now in the
earlier as well, yeah.
In the next 2 to 3 months, we have NEET, super specialty, and FNB exams in India. So now in the next 2 to 3 months, so probably they will be by October, November, December, all these exams will be happening. So if that is okay, if I can do this thing like in the next year, the part 3.
That's okay, my dear Nupur. I will organize you in the same way. You just talk to me, but take a start early and join the big batch, because for all that 6 months, 8 months, your access would stay with you, you know?
Okay.
So that's not a problem. Price is the same. Everything is the same. But booking early would give you a benefit that everything would open up just now. And you will be, for example, 2 of the Malaysian students, they've joined 62nd, which is like May 23. They're telling right now that, ma'am, we want to open up the website. We'll be starting now, but we want to aim longer ones. It's okay. The only difference is the same curriculum. Everything would be the same, but the sessions would not be quick. They'll be like after 2 to 3 weeks, you know?
Okay,
so that keep on going, like
so it's like a slowly it will keep happening.
Yeah, so everything would stay with you. Yes, everything would stay with you. The website would stay with you till that exam. The groups would be different. November group would be different. The May group, all the students for the May 23 would be like different. Got it?
Okay, sure. Thank you so much.
Yeah, thank you very much, my dear. Thank you. All right, any other question, please? Hello, Claire? Okay, that was lovely. Thank you so much. I'm going to put that in the fast track as well. Don't worry at all. Okay, thank you, Carolyn. Thank you for lovely hearts. I have been missing you guys like anything, and I'm so happy to meet you guys. And anytime you people have any query, just drop in a message and you'll find us around. Thank you very much for being the best students in the world. And thank you very much for being awesome listeners as always. Love you all. Take very good care of yourself. Best of luck from the entire team of RFA Tutors. Love you. See you guys soon with the congratulations and celebrations. Bye-bye from my side. Have a lovely day. Love for you all. Thank you. Take very good care.